Welcome, everyone. Today we will be discussing your health and how to navigate the healthcare system in the United States. In the U.S., a senior citizen is anyone of retirement age or a person that has reached age 62 or older. You are responsible for your health and have the right to decide about it. You have the right to be treated with respect without being discriminated against based on your background. Doctors will not share your health information with anyone without your permission. To have access to care, you will be able to apply for Medicaid or Medicare. Medicare is a federal health insurance for anyone age 65 and older, and some people under 65 with certain disabilities or conditions. Medicaid is a joint federal and state program that gives health coverage to some people with limited income and resources. If you are sick and need emergency care, go to the nearest hospital emergency room or call 911 for an ambulance. When you call 911, be sure to give them your address, as well as the number from which you are calling. You should also briefly describe your health emergency. If you cannot speak English, you can ask for an interpreter. Most hospitals must treat you during a medical emergency, even if you cannot pay. If your concern is not immediately life-threatening, you should not use an emergency system and visit your primary care physician or local urgent care instead. If you do not have medical insurance and the doctor's offices or clinics require it, talk to your local Department of Social Services, who can give you information about some free or low-cost healthcare facilities. You can ask your caseworker to connect you with local departments of social services. When visiting a healthcare facility, you need to bring a photo ID, such as your driver's license or passport, insurance card or Medicare, and a checkbook, credit card, or cash with you. It is important to be on time for your appointment. If you are late, you may not be seen, and you may have to pay a fee. In the doctor's office, you may need to fill out some forms. Medical forms are an important part of your patient records. If you cannot read or write or cannot speak English, you can ask for an interpreter. Your doctor is your partner in healthcare. Therefore, ask questions about anything that concerns you. Tell your doctor everything he or she needs to know about your health. The doctor may not spend much time with you. U.S. doctors are taught to keep a professional distance, so they may seem cold or uncaring. In the U.S., it is respectful for a doctor to look you directly in the eye. He or she may even greet you using your first name only. In the U.S., you must go to a pharmacy or drugstore for medicine the doctor has prescribed. Take the doctor's prescription with you. If you have insurance, take your insurance or Medicaid card plus a picture ID. The pharmacist will also ask you for your date of birth. If you have brought medication or herbal medicine from Afghanistan, you need to tell your doctor about it. It may be out of date and will no longer work. In the U.S., most patients go to the doctor's office or clinic alone or with one other person. Therefore, try not to bring too many family members with you. You can bring one person you trust. No family member can stop you from the care you want. When it comes to death and dying, in most cases your family will be able to help you when you are dying. If you die in the hospital, you may have to follow some rules about visitors ahead of your death. You can decide about your care at death. It is best to complete advance directives, a living will. You can also choose a guardian or family member to make decisions for you. If the guardian or family member is not available, a judge can decide on treatment.